All right, thank you so much, Allie. Well, health coverage is in the crossfire for hundreds of thousands of patients across southeast Michigan.
Yeah, they're stuck in the middle of a contract dispute with Michigan Medicine and Blue Cross Blue Shield, and it has reached a breaking point.
Now, those patients are receiving letters like the one on your screen warning that if Blue Cross and Michigan Medicine don't reach an agreement by June 30th, U of M doctors, hospitals, and services will be dropped from the Blue Network.
And this is a story that we have been following over 2 months now.
7 News Detroit reporter Kiara Hay joins us live from the Blue Cross Blue Shield building in downtown Detroit. She's highlighting the concerns of patients caught up in the uncertainty. And Kiara, what would this mean for patients if the two sides can't reach a deal?
Yeah, that means that hundreds of thousands of people will have to seek out new doctors and avoid going to certain hospitals. And Keenan and Alicia, if you've ever received an out-of-network bill, you understand why so many people are apprehensive right now about this ongoing feud between Blue Cross Blue Shield and Michigan Medicine. And this feud all boils down to money. You have U of M saying that Blue Cross Blue Shield is asking for a 30% cut in reimbursement payments, while the health insurance network claims that U of M is asking for a 44% increase in reimbursement. Caught in the middle of this conflict, of course, is a 300,000 patients whose coverage could be cut in a matter of months, which is worrisome for so many people, including Wendy Dwyer, who battles a chronic heart condition and will now have to seek new medical care.
Like I Google searched long QT and the best doctors in Michigan for long QT, and they're all out of Michigan Medicine.
And when you talk about insurance, though, do you know how much it would cost if you had to pay extra, like out of network or 40%?
I do know the angiogram last year cost about $45,000.
$45,000 bill just for one medical treatment. That's what a lot of people could be facing if they choose to still go with Michigan Medicine, even if it becomes out of network. So there is a deadline in a letter sent out to patients of Blue Cross Blue Shield. About 250,000 people have until July 1st when Michigan Medicine would be considered out of network, and about 50,000 people who have chronic illnesses, they'll have until September 29th. So Keenan and Alicia, a lot more to come from this story. In Detroit, I'm Kiara Hay, 7 News Detroit this morning.
And hundreds of thousands of patients are caught in the middle without the power to do anything while these two giants in healthcare